Good day! Today, we're going to discuss the educational philosophy, which is progressivism.
Imagine this. You're in a classroom filled with eager medical students. The professor stands in front, lecturing for an hour about heart disease. At the end of the session, the students can list symptoms, treatment, and medications. But can they truly understand how to diagnose or treat a patient with heart disease? Now imagine a different scene. The students are divided into small groups working through a real-world case where they have to diagnose a patient with chest pain. They discuss, ask questions, and make decisions just like they would in a real clinic. The professor isn't lecturing. She's guiding the students, prompting them to think critically and reflect on their choices. So, which method do you think prepares students better for the real world? The second approach is at the heart of progressivism, a philosophy that emphasizes learning by doing. Today, we're going to explore how progressivism transforms education, especially in the health professions where hands-on experience is key. At the end of the session, learners should be able to trace the origins of progressivism, particularly the contributions of key figures like John Dewey, differentiate progressivism from other educational philosophies, analyze the role of the teacher in a progressive classroom, identify challenges and limitations of implementing progressivism, explore the integration of technology in progressive education, evaluate the effectiveness of progressive methods in improving critical thinking and problem-solving skills. And learners should be able to create strategies for applying progressive learning techniques in their own teaching or clinical education setting. Let's begin by exploring the history of progressivism. Progressivism arose as a response to the rigid authoritarian education systems of the 19th century, which focused on rote memorization and strict discipline. John Dewey and other progressives criticized this rote learning for stifling creativity and critical thinking. Progressivism sought to move away from this passive learning model. Dewey, a major proponent of progressivism, believed that education should be grounded in real-world experiences and prepare for active participation in a democratic society. He advocated for schools to be more like a laboratory for students where they can explore, experiment, and engage in active learning. Piaget argued that humans were active meaning makers who construct rather than receive knowledge with much capacity to improve intelligence over a lifetime. Education should focus on the whole child and their experiences. Learning is active, not passive, and should prepare students for real-life problem solving. With the history of progressivism in mind, let's now delve in its core values. First, learning by doing. Progressivism emphasizes experiential, involving all the senses, hands-on learning where students engage with real-world problems, fostering deeper understanding and retention of knowledge. It is student-centered. It focuses on individual needs and active engagement in learning. It helps develop critical thinking. It encourages questioning, analysis, and independent thought. It promotes teamwork and social interaction in learning. There is real-world relevance. Its curriculum connects learning to real-life situations, fosters active citizenship and participation in decision-making. It supports emotional, social, and intellectual growth, hence a holistic approach. Now that we've explored the core beliefs of progressivism, let's take a moment to see how these ideas set progressivism apart from other educational philosophies. Let us compare it with essentialism, perennialism, and constructivism. Essentialism focuses on a core body of knowledge that students must master, with teachers as the primary authority. In contrast, progressivism emphasizes the learner's experience and curiosity. Perennialism centers on enduring truths and classic works, advocating for a teacher-centered approach. Progressivism, however, encourages learning that is relevant to students' lives and current societal needs. What then is the role of a teacher in progressivism? A teacher is a facilitator, a collaborator, and a coach. In a progressive classroom, the teacher's role is not to deliver information, but to guide students through the process of discovery. Teachers pose questions, encourage exploration, and support students in developing critical thinking skills. Teachers work alongside students, encouraging collaboration and offering feedback. They help students reflect on their learning rather than simply providing answers. In a medical school, using a progressive strategies, a teacher might guide students through a case study, prompting them to ask the right questions and develop their diagnostic skills rather than providing a list of symptoms to memorize. Now let us identify the challenges and limitations in the progressive approach. The challenges in large classrooms. Implementing experiential and student-centered learning in large groups can be difficult. It requires additional planning, resources, and sometimes technology for group simulations. Progressive methods such as problem-based learning often take more time than traditional lecture-based teaching. In health professions, educations, where curricula are dense, this can be a limitation. Some educators may be resistant to moving away from the traditional methods such as lectures and exams, which they perceive as more efficient or reliable for content delivery. It can be challenging to assess students' learning in a progressive classroom because the outcomes are often qualitative, like in collaboration and reflection, rather than quantitative, like that of the test scores. As students become active learners, exploring, creating, and collaborating, technology guides and enriches their experiences. Let's explore how these tools not only support but elevate the principles of hands-on student-centered learning. Progressivism in education emphasizes active, experiential learning where students engage directly with the material and develop critical thinking skills through hands-on experiences, like in medical education. Tools like Endeavor and Anatomage bring this philosophy to life by allowing students to practice procedures in a risk-free environment by utilizing high-fidelity mannequins and digital lifelike human anatomic representations. Similarly, interactive platforms such as learning management systems enable collaborative student-centered learning, fostering engagement and peer interaction even in virtual classrooms. Together, these technologies embody the progressiveness commitment to learning by doing, promoting deeper understanding and skill development. How effective is progressivism in critical thinking and problem solving? Progressivism fosters critical thinking by encouraging students to evaluate, synthesize, analyze information rather than simply memorizing it. This is particularly essential in health professions where clinicians must make evidence-based decisions through real-world scenarios and simulations such as patient case studies. Students apply knowledge to diagnose and treat conditions, enhancing problem-solving skills. Research consistently shows that progressive methods like problem-based learning outperform traditional lecture-based approaches in cultivating these essential skills, particularly in medical education. Now, let us list strategies how we can apply progressivism in clinical settings. Case-based learning in health professions education means introducing clinical case studies that require students to diagnose and treat patients based on the information provided, promoting active learning and critical thinking strategy. Reflective practice can also be used, which encourage students to maintain reflective journals where they can analyze their clinical experiences. Interdisciplinary learning involves students from various health professions like the nursing, medicine, and pharmacy in collaborative projects. Student-led learning allows students to take ownership of certain aspects of their learning, such as selecting topics, of interest for projects or leading discussions on recent clinical research. For summary of key points, progressivism focuses on experiential student-centered learning, which is highly relevant in health professions education. This philosophy prepares students to be adaptive, collaborative, and reflective practitioners. Now, here are questions to ponder. What is one key takeaway from the core values and principles of progressivism that you can apply in your teaching? What challenges might you encounter when implementing progressivism principles in your practice? Let's do some activity. The activity is entitled Design Your Own Progressive Learning Module. This is an individual activity. You can select a topic relevant to your field of interest. Create a progressive learning module that contains the following: experiential learning, inquiry-based learning, collaboration, and reflection. An example would be for experiential learning on the title Initiating Early Breastfeeding in a Newborn. You can use an infant simulator like the PediaHall. Scenario would be a newly delivered baby who is active and crying and will be used for the procedure. For the inquiry-based learning, is the baby a candidate for routine early care for newborn? What are the steps needed? Collaboration. A student will act as a nurse, the other one a pediatric resident, the other one will act as the one who calls out the time of delivery. And for the reflection after the activity, allow each member to comment on the procedures if done correctly, then reflect on what they have learned. Thank you and God bless.